Hi, everyone, and welcome back to Athletes in Practice, where we talk with former college athletes who have taken skills, discipline, and mindset they developed in sports and carried them into careers in medicine. I'm Hunter Engel, and today I'll be interviewing Dr. Tiana Woolridge. Dr. Woolridge is a sports medicine physician specializing in the non-surgical treatment of acute, chronic, and overuse injuries with particular expertise in concussion care and athlete mental health. She's a double board certified in pediatrics and primary care sports medicine and works with athletes of all ages to help them safely return to the activities they love. Before medicine, Tiana had an incredible athletic career. She was a dual sport athlete in high school, winning a basketball state championship and earning a USA Volleyball Junior National gold medal. She then went on to play Division I volleyball at Princeton, where she was a two-time All-Ivy League player and even led the Ivy League in hitting percentage as a middle blocker. Pretty impressive. After Princeton, she pursued medicine, earning her MD from UCSF and an MPH from Harvard School of Public Health, completing a pediatrics residency at UCSF and later a sports medicine fellowship at UCLA, where she worked with athletes from UCLA teams, as well as Lakers, Sparks, and Dodgers. And in addition to her clinical work, she's deeply involved in research and advocacy surrounding athlete mental health and health equity, particularly working with school-based mental health programs serving underserved communities. All right, Dr. Woolridge, to start us off, can you walk us through what you're doing today in sports medicine and pediatrics, and how your journey from being a Division I volleyball player at Princeton led you into medicine?
Absolutely. Thank you for the intro. And man, oh my gosh, the journey down, trip down memory lane. I was like, man, I forgot about that.
Yeah,
Like the basketball state championship. I was like, man, I was riding the bench, but like, yeah, technically, yeah, I did it, right? So
it counts. It counts.
it counts.
They don't ask how.
Exactly. So yeah, man, it's been a great journey. I would say all the way through to address the first part of your question about what I do on a day-to-day basis. I am as you mentioned, a non-surgical bone and joint expert is sort of how I put myself out there. So on Monday through Friday, I'm in a clinic setting all day Monday, Tuesday, half day Wednesday, all day Thursday, Friday. And I'm seeing patients, I tell people aged 3 to 93. So a very, very broad range of people, kiddos who might have fallen on the playground and broken their arm, all the way up to people in their 80s and 90s who, maybe can't get surgery because of other medical issues, or they don't want to get surgery, but they have kind of aches and pains, significant like bone-on-bone arthritis, things like that. There's lots of procedures that I just get to do in clinic, which is awesome. So using ultrasound to kind of guide needles into particular joints and around tendons, I'm able to inject anti-inflammatory medications, regenerative medications like platelet-rich plasma. I do a lot of shockwave therapy, which is essentially a pressure wave therapy that can break up scar tissue, stimulate blood flow, and stimulate healing of chronically irritated tendons. So really, really cool things. I get to work with my hands quite a bit. Even though I'm a non-surgical doctor, there's a lot of in-office procedures that I do on a daily basis.
Right.
Outside of the clinic space, I am also the head team doctor for St. John's women's volleyball team, which is very fun, very full circle for me as a prior college volleyball player. So I, do all their preseason physicals. I go to all of their games, and I'm there in case of medical emergency during a game. I take care of, various orthopedic and medical issues that may pop up throughout the year. So when you think about an athlete, there's lots of other demands on the body, demands on their heart, demands on their brain, demands on their skin. And so I'm managing all of those things, cardiac issues, breathing issues, respiratory issues, skin issues, all of that, which is a fun blend of the kind of general primary care side as well as the sports side of things. So I'm basically their doctor, which is really fun.
That's awesome. That's awesome.
Yeah. So it was a really, really great, it's a really great position to be in, especially given my background. I always tell people, to answer the second part of your question about, what about volleyball in Princeton sort of brought me into this. I actually was a patient here at HSS first
Wow.
before I became a doctor here. So the first day of my last preseason in college, we were doing, our preseason testing. This is even before the first practice. Like
Hmm.
this is when you get in the weight room or you're on the field, you're doing your sprint testing, like
Hmm.
jump testing, all of that. And I was crushing it, right? Like I was
Hmm.
working super hard all summer before my junior year. I was like, this is getting into my senior season. We're winning an Ivy championship. We're going to the
Hmm.
NCAAs. Like, it's going to be a great year. I like didn't really tell my mom about this part, but I was like, low key, I'm trying to defer med school for a year, try to play overseas for a little bit. So
Yep.
I had all these great big dreams, and so I trained. Unfortunately, was overtraining a lot the summer
Hmm.
before because again, I had these kind of big goals and things I wanted to do, and definitely
Hmm.
under fueling, which is kind of something we can talk about later. But overtraining, under fueling. So I get to that first day, and I'm crushing it. With
Yeah.
squatting and my vertical jump, like jumping out of the gym, all this stuff. Then we get to a shuttle test.
Yep.
And we're doing shuttles, kind of sprinting back and forth, changing directions quickly. And I get all the way to the last one. I plant my foot to change directions, and out of nowhere, I feel the loudest pop
Oh
in my
no.
body. And I'm like, oh my God. And I remember reaching back to my ankle and just touching where
Oh.
my Achilles is. And I was like, there was nothing there. Like it was just
Oh
like
no.
soft skin. It was awful. And I never had Achilles issues, like no ankle problems before. And it was really devastating. And kind of in that moment, I was like, that's it. And so I, lost the season. That was a career-ending injury for me.
Sorry
And
about
that's
that.
really, yeah, yeah. It was awful in the moment, but really important at the time because there was a
Hmm.
lot of skills that I learned from that recovery process that I transitioned into how I treat patients going through the same process every day in clinic. So
Okay.
painful, but a necessary experience for me that I think makes me a better, more compassionate doctor. So 10 years almost to the day after this injury and after the surgery I had at HSS, I came back as a primary care sports medicine doctor here. So it was pretty cool.
That's an awesome full circle moment. And I'm happy that you're better. I'm happy that your Achilles is now holding up.
Yes, yes, it's
It's
one piece.
it's in one piece. That's awesome.
Yeah.
Um well, medicine demands a lot of time, emotional energy, resilience. Do you feel the passion and competition, like competitive drive you had as an athlete, as you were talking about, mirrors the passion that you bring to caring for patients today?
Absolutely. I think there's so many skills that I've gained from, being a member of a team and being an athlete that directly transition.
Hmm.
I tell people medicine really is a team sport. Like I think that's something I didn't
Yeah.
quite recognize or understand when I was kind of pre-med or in high school. I was like, oh, a doctor is just kind of independently doing their thing and that's it. And that's
Hmm.
really not the case. Like I'm essentially like a team captain or a coach in a sense
Hmm.
where there's a lot of folks, whether it's the front desk staff, my assistant, the nurses that are kind of rooming patients and helping me out with procedures. I'm
Hmm.
constantly kind of coaching and leading and guiding our team in the
Nice.
care for our patients. And so those skills directly transfer over really well. I think just the grit, determination, work ethic from, training, working towards a goal and being prepared to put in a lot of effort to get to that goal,
Hmm.
that directly transferred over to just like making it through the medical journey. Because it
Yeah.
is a long journey. I
Hmm.
started, as I mentioned earlier, from being a senior in college, an athlete. 10 years later, I started my first kind of quote unquote
Yeah.
real job as a doctor at HSS. So it's a long journey, a lot
Yeah.
of delayed gratification. And we're used to that, right? As
Yeah.
athletes, we're used to putting in the work, putting in the grind, kind of lifting ourselves up when hard things happen. Because, things happen in med school. You get a
Hmm.
bad grade, you have a hard rotation, like you got to kind of pick yourself up and keep yourself going.
Yeah.
I would say, especially in med school, when you start to get into your medical school rotations, those can be
Hmm.
tough because you essentially spend 1 to 2 weeks on different units within the hospital. So it's like, okay, I'm a psychiatrist for a month. Now I'm a
Yeah.
neurologist for a month. Now I'm a pediatrician for a month. Now I'm a general surgeon for a month. And it's like,
Yeah.
go, go, go. Something new, got to be on your feet, got to be ready to go. So it can be mentally, emotionally, and physically exhausting. And so having that work ethic from, being an athlete, having that
Hmm.
ability to kind of turn on a dime and adjust and, like just really, really lock in was so
Hmm.
important. And I feel like it's something that helped set me apart from my peers and that
Hmm.
I was, I could adjust. Could keep myself motivated. I could work hard. So I think that's
Hmm.
something that a lot of athletes carry, especially when
Hmm.
times are hard, being able to kind of keep going and keep pushing.
Yeah.
So I would
Yeah.
say that was really, really important to kind of carry through.
And follow-up question.
Yeah.
Have you ever shared lessons or mental skills from your athletic
Yes.
background with colleagues, trainees, or even
Mhm.
patients who weren't athletes?
Absolutely. So I actually, even as I was answering the last question, I was thinking
Yeah.
about this one skill that I used that I learned from my coach, more so internally, and then I'll get to sort
Hmm.
of what I share with others. So
Yeah.
I remember my sophomore year, my assistant volleyball coach, Sam Schweisky,
Hmm.
was super big on like sports psychology. I think he had gotten like a major or a minor in sports psych when he was in college. And so
Hmm.
he would do this like sports psych talk with us at the beginning of preseason.
Right.
And that was really at a time, this is back in, oh my God, I'm dating myself here, but this is back in
2012.
2012, exactly. Oh man, God, that was 14 years ago. Woo! All right. Let me go pick up my AARP card, like senior citizen discount.
You got a couple more years for AARP. I made a
Oh,
comment
not
today.
many. Not
Yeah.
that many. But anyway, so yeah, so I remember that was my first introduction to like sports psychology in general,
Hmm.
like that field of using your mind as a tool to like improve your game and kind of those mental performance strategies that you could use. So he
Hmm.
taught us a lot about, the concept of visualization, kind of mentally picturing what you're going to do before you do it and mentally picturing
Hmm.
yourself doing it successfully. And so one of the ways that he taught us was, okay, before the ball comes over the net, if you know a certain play is about to happen and the ball's coming to you, you need to hit it into this specific part of the court. Visualize yourself doing that before the play happens, because
Hmm.
that's going to prep your mind and your body for success, like as you
Hmm.
execute that skill. And I
Hmm.
remember telling him when I was a third year medical student, I was like, man, Twice, like I used that when I was on my surgery rotation in medical school. Like I was super nervous about the first time they were going to hand me, the suture material and the pickup and say, hey, close this,
Hmm.
incision that we used. And everyone's staring at you, the pressure is on,
Hmm.
and you're super nervous and your hands are shaking. And I remember like going through the same process where I was like, okay, use that same skill, visualization, apply
Hmm.
that here, and I was able to successfully do it. So it applies even when I'm doing new procedures or kind of more complicated procedures in the clinic setting. I'm still using those visualization strategies and other strategies that he taught along the way and things that I learned from my own
Hmm.
mental health journey dealing with my injury. I'm teaching those things all the time. So
Hmm.
mindfulness being a huge one, being able to stay as present in the moment as possible, being able to take the recovery journey one step at a time and not get too lost by
Yeah.
kind of setbacks and times in the journey where you feel like I've been doing this rehab forever and it's not getting better. Being able to
Hmm.
kind of ground yourself and kind of counter those negative thoughts with more positive
Hmm.
ways of thinking. Stopping those thoughts that are just like harmful or defeating and just saying,
Hmm.
okay, what is true, what is helpful, like checking all my thoughts by that. So those are things that I share with a lot of my patients on a day-to-day basis.
It's really cool. I've recently kind of gotten into running, and my dad, he says like, all right, for all the hills, I just want you to put your head down and like, just you're gonna slow down your pace, and you're gonna put one foot in front of the other, and you're not gonna
Yeah,
look up, and then you're gonna be at the top of the hill like before you
yeah.
know it.
That's a
So
great motto
that's
for med school, honestly.
yeah,
Like,
yeah,
not even joking. Like, that's kind of the way you do it. And then all of a sudden you
yeah.
look up and you're an attending physician, like talking to pre-meds who want to be in your
There we
chat.
go.
So,
That's me. That's me.
yeah, I love
Um,
it. I love that.
so when you look back at your pre-med athlete journey, so you look back at your time at Princeton, what was the biggest challenge balancing D1 athletics with academics and pre-med
Mm,
requirements, and how did you navigate that?
yeah, whew, man, that was not for the weak. That was not
Lots,
for the weak.
lots of
You
time and
know,
stone.
yes, yes,
What was
yes.
your first? What was your library?
Oh man, well, so I wasn't much of a library girl. I honestly
Okay.
wasn't. I was very much Canon. So my Canadian
Okay.
company, Canon Dial Elm. So I spent a lot of
Yeah.
time at Canon
Of
studying.
course.
Before that, I was a Frist girl, so I would just like go
Okay.
study
Yeah.
in Frist.
Yeah.
So I
Yeah.
was one of those two through my whole time. But um, yeah, I would say it's hard, right? Like
Hmm.
you constantly have this feeling of like wanting to be able to do more on both ends. Like,
Hmm.
you think about, oh, if I could get, more rest or if I can get in more reps or put more time into my game, like that would help me out here. But then on the other hand, you're like, you go to class, you go to a study group and you're like, oh, if I could just spend more time studying or actually go to those office hours that are at the same time as lifting, like
Yes.
that would be a benefit. So I think there's a lot of like, you're getting pulled in two different directions the entire
Hmm.
time.
Hmm.
And I think there's a lot that happens mentally with that of just like, oh, I should be doing this. I should be doing
Hmm.
that. So I think giving yourself grace is the first and most important part of this.
Hmm.
Um, I think the second most important part is really trying to align yourself with other people who are doing the same thing that you are. So I was lucky in that I had two other teammates who
Mm,
were also pre-med in my year. And so they're both residents right now. One's in orthopedic surgery. Actually, is she in gen surg or ortho? They're both in surgical residencies.
hmm.
And so we were, doing organic chemistry problem sets together on the bus going
Yeah.
to games and kind of commiserating and going through it together. So definitely finding your tribe of
Yeah.
people who know what you're going through and can
Hmm.
support you and like help lift you up and keep you motivated when you're feeling down is super important.
Hmm.
And then I would just say time management, time management, time management. Like
Hmm.
really, really getting good with that because things only get harder. Like when you get into medical school, yeah, you may or may not be continuing to participate in athletics, but just the amount, the volume of what you have to study and learn is even greater
Hmm.
than what you do in high school and in college.
Hmm.
When you get into rotations, you're balancing, working in the hospital with studying for tests and potentially doing research and all these other things. So
Hmm.
the demands on your time will just keep getting bigger. And so I was somebody who just like lived and died by a planner. I'm, old school. I know I went to college in the like 1800s, but
Yeah.
I was a pen and paper planner kind of girl. Would sit
Yeah.
down every Sunday, say, okay, what are all the assignments I need to do? What is all
Hmm.
my training? I'm gonna block out the week. Literally, I would plan my day like hour by hour by hour,
Yeah.
including naps, including time with friends, like
Need the
the fun
naps.
stuff too. Exactly. Oh
Yeah.
my God, big nap girl. So yeah, so just really figuring out like what works for you, whether it's using your Google Calendar, whether it's a pen and paper planner, and really start chunking out your time and getting really strict and disciplined with yourself about I'm going to do this at this time to make sure
Hmm.
that it all happens. And like I said,
Hmm.
being kind to yourself in the process. The one
Hmm.
last thing I'll leave on this kind of specific question is I remember being super anxious, especially when I got to my fourth year of medical school,
Hmm.
about my competitiveness as it compared to non-student athletes.
Hmm.
I was like, my GPA is lower, right? Like my MCAT scores are lower. And that's because I
Hmm.
haven't been able to have put in the amount of time and effort into my academics because I literally only had, maybe 60% as much time compared to,
Yeah.
all other non-athletes. And
Yeah.
so that stressed me out a lot. I was like, am I going to be looked at as like a worse candidate? I'm just like not going to get in anywhere. You start all the negative self-talk starts
Right.
to settle
Right.
in.
Right.
And I can tell you now, I've sat on a lot of those application or admission panels, right? As a second year, third year med student, they'll have you like work on the admissions committee, interviewing applicants, helping with some of the write-ups.
Hmm.
Same thing when I was in residency and fellowship. And honestly, the athletes we look at with a lot of favor.
Hmm.
We take into account like, oh, of course their GPA is lower. Like they didn't have the time. Like,
Yeah.
obviously,
Yeah.
these scores are going to be lower. And
Yeah.
how awesome is it that they were able to balance a heavy academic schedule with their athletic
Hmm.
schedule? How
Hmm.
awesome is it that they know what it is to work in a team and they have that grit and determination to be, an NCAA athlete or to be,
Hmm.
a high level athlete in that way. So I wish I could go back to myself and tell myself that in my junior year in college when I was applying to med school and like freaking out. That it does, being a student athlete does carry a lot of weight when it comes to medical school admissions.
Hmm. Hmm. I was actually I just had this conversation with my mom and
Mhm.
we're just kind of talking about my scores and my grades
Yeah,
and like doing all this stuff and she was just like it's gonna be okay, you're fine, like
yeah,
whatever, it's good. And then I
yeah.
also I actually tried to balance I was trying to do like my major and it wasn't a science major and then I tried to sprinkle in some science classes. It did not
Right.
work. Ended up going to UVA doing a post bac.
Oh, nice.
And then my grades got infinitely better. It was it
Yeah.
was it was pretty insane. And
Yeah.
you're doing a lot of you're answering a lot of my questions before I ask them, which is so cool. Okay, so the next thing that I wanted to ask you about. So you pursued both an MD and an MPH
Yeah.
at Harvard. What motivated you? You said a lot of motivation to study public health alongside medicine, and how
Yeah.
has that shaped how you approach patient care today?
Yeah, no, I like 1000 out of 10 would recommend that everybody who is interested in a medical degree also consider doing an MPH. I feel like it was just such a great complement to the MD degree.
Hmm.
So I was actually a member of the School of Public and International Affairs at Princeton.
So
Were
was
you too?
that. Yeah.
Hey, love it, love it, love it, love it. I knew the universe.
Spia. Yeah.
Yes, this like SPIA student athlete, ortho
Yeah.
connection. This is amazing. This is awesome. So I very much was always interested in medicine sort of on a large scale.
Hmm.
Of course, I would take biology classes, chemistry classes. I'm like, this is really cool. Like, I like science in general. But when
Hmm.
it came down to medicine, I was like, I am fascinated by how, disease spreads. And I'm fascinated by
Hmm.
how people make decisions about their health care and about their health behaviors, and about how governments and countries dispense healthcare resources,
Hmm.
especially in like resource limited settings. So those things were very fascinating to me.
Hmm.
And I remember when I got to Princeton, I initially signed into or planned on doing molecular biology. And I was like, oh,
Hmm.
I like bio, I'm pre-med, like naturally this makes sense. But I was
Hmm.
getting into those classes and there was a lot of time, in the microscope, pipetting, like looking at cell biology, and like shout out to the people who love that. I was not one of those people. And so I had to have like one of those moments where I really sat down with myself and was like, hey, this isn't where your passion is. Like, yes, you find this cool,
Hmm.
but this is not where your
Yeah.
passion is. Like, shift gears. It's okay to do so. And so I was really
Hmm.
happy to find SPIA. I was within the like health and human welfare track. And I
Yeah.
got to take a lot of courses that were sort of outside of the box, but taught
Hmm.
me a lot about like policy and
Hmm.
health behaviors and disease ecology and epidemiology. And that
Hmm.
was really awesome. And so when I was getting into med school, I was like, great, this will be a continuation of a lot of things that I was learning. And I found
Hmm.
that medical school, you have to learn every single thing there is to know about the human body and every single
Yep.
thing that can go wrong with the human body.
Yep.
So it's a lot of hyper focus on like the human anatomy and just the
Yeah.
intricacies of the internal aspect of what it is to be human.
Hmm.
There was less of the sort of population health stuff,
Hmm.
disease spread, all of those things. And so and my getting into my second and third year of med school, I was like there's something missing. Like I want to go a little bit
Hmm.
deeper into these topics. And so I actually did, and a lot of people do this. I did not realize this was something that people could do until I got into med school. A lot of
Hmm.
people will take a year gap in between their third and fourth year of medical school and get another degree or, really dive deep into a research project for a year before
Hmm.
going into their fourth year. So
Hmm.
strong recommendation. I did that after my third year at UCSF. I did a 9-month MPH program at Harvard and then came right
Cool.
back to finish med school. And that year, again, gave me a lot of great academic knowledge, but it
Hmm.
also gave me the framework. I really was able to wrap that entire year around a practicum experience or a fieldwork experience, which was a requirement for graduation, to kind of get out of the classroom and apply what we were learning to some type of community setting or some type of public health
Hmm.
issue. And so
Yeah.
my mom and I were actually able to work together for a year to create a school-based mental health program for a
Hmm.
group of schools in the inner city in LA, which was awesome. Like my mom and I, both personally and professionally, have a lot of ties to mental health. My dad grew
Hmm.
up. My dad developed a substance use disorder when he was a professional athlete, and so kind of the
Hmm.
athlete mental health realm is sort of near and dear to my heart.
Yeah.
I, of course, dealt with my own mental health issues dealing with the injury.
Hmm.
And my mom, who worked in this kind of inner city setting, was like, there is so much need as it relates to mental health in these settings, but there's just not the
Hmm.
resources and the knowledge of how to support these kids. And
Hmm.
so we were able to kind of combine powers essentially. And I was able to directly apply everything I was learning in the classroom at Harvard around
Hmm.
health program design
Yeah.
and implementation to create this program over a course of a year, which was incredible. So
Hmm.
I got a deep dive into just the basics of how you educate
Hmm.
people about health in a
Hmm.
way they can understand and get behind, the motivation behind different health behaviors,
Hmm.
how you work on multiple levels of what we call the socio-ecological model, working at the individual level, the interpersonal level, the school, communities, policy level to
Hmm.
make an impact on the overall health of an individual and a community. So it
Yeah.
was incredible work. And like I said, I'm able to take that now and think more about, as I work with college sports setting or youth programs, youth sports programs in the community, I'm able
Hmm.
to apply that same knowledge where it's like, okay, if we want to make an impact on either physical or mental health, mental injury, physical injury or mental injury, if we
Hmm.
want to make an impact here, we have to think of it at all these different layers of the
Hmm.
socio-ecological model.
Hmm.
So it really does have an impact on how I deliver care, both on a one-on-one basis and how I think more broadly about how I can work outside the hospital to impact health for the better.
That's super awesome. And what do you think about the HSS Wellness Center?
Oh my God, the Wellness Center is amazing. I'm in there all the time. We're so
It's so
lucky. We're
good. Yeah.
so lucky that like HSS really has made a commitment to the well-being of all their
Yeah.
employees here. not just the doctors, but everyone. And so
Yeah.
I take like free fitness classes all the time, which are awesome.
Yeah.
I
Yeah.
accidentally signed up for kickboxing once. I thought it was a weightlifting class.
Yeah.
I signed up for kickboxing. I've been hooked ever since.
Yeah.
So,
Really?
like, learning how
Okay,
to
that's awesome.
kickbox, super
I've, tr-
fun. There's
I
definitely
tried
some
kick.
relations. Yeah. Have you
Yeah.
done it? You and Ben?
I tried kickboxing before and I was just not good at it. So I
No, you gotta
stopped.
try it.
Yeah.
I literally had never thrown a punch. Well, that's a lie. Like me and my brother, I grew up with two older brothers, so I'd thrown
Right.
punches before growing up.
Yeah.
But no, it's so fun. It's a great workout. And for me as a volleyball player, I'm used to hitting something as hard as I can, and I haven't been able to do that for a while. So it was nice to
Yeah.
get back into that with
Yeah.
kickboxing.
Yeah. Yeah. That's
Uh,
awesome. Okay, wait. So you just talked about your two brothers. You grew up in a
mhm.
family full of successful athletes. How did your brothers influence your athletic journey growing up?
Yeah.
And did that environment shape your eventual path into medicine, or did it kind of not really have as much impact there?
Yeah, no, I would say, between my dad and my brothers, big basketball family. So
Hmm.
dad played professional basketball for about 13
Yep.
years. Two older brothers both played college basketball.
Hmm.
One played professionally after that. So, from
And
the
you got a
time
state
I was
championship, though.
on the
Did they have
bench, still
that? Did they
counts,
have
still
that?
counts.
Did they have
I know,
one?
I literally rub that in their face. It's so funny. So we all went to the same high school.
Yeah. Yeah.
And if you win a state championship, they put up a banner with like everyone's name on the team. And
Nice.
so even if you walk into Harvard Westlake right now to their main
Yeah.
gym, like Woolridge is up there, and I'm like, oh hey guys, you know that
Yeah.
Woolridge? That's
Wait.
me. That's not you guys. And they're like, I
Yeah.
actually played, and I'm like, who cares? My name
Yeah.
is up there.
Yeah. Yeah.
Oh man, too funny. But yeah, so grew up in a big basketball
Yeah.
family. The expectation of excellence was kind of always there, right? Like growing up with a father who's playing and competing at the highest
Hmm.
level, kind of in the country, in the world, more or less.
Yeah.
So that definitely sort of put a level of, I would say, kind of confidence and confident expectation, where it's like, okay, like I'm capable of great things. I've seen my family and my dad, my brothers, achieve, and I've seen hard work transition into kind of being able to achieve your biggest, wildest dreams. And so
Hmm.
that definitely set that into motion. I would say also from having a personal experience of dealing with injury, saw plenty through, various things that my dad experienced, my brother's experienced, I experienced. So I knew a lot about just anatomy. I
Hmm.
crushed my musculoskeletal anatomy when I
Hey.
got to
Yep.
medical school.
There you go.
So that's one benefit I'll take from being injured all the time and just
Yeah.
spending hours in the game ready, just like staring at anatomy
Yeah.
diagrams of the wall of the training room. So
That's awesome.
definitely so real, so real. But yeah, so from the, like I said, the mental health side, the physical health side, there was a lot of personal experiences
Hmm.
with injury. And so really fortunate to be able to kind of carry that forward. And it's really awesome. Like a lot of patients still will bring up, more so my dad, and their experiences, kind of like watching him or having seen him
Yeah.
play, and how exciting that was for them, which I really appreciate. He actually
Hmm.
passed away now about going on like 13, 14 years ago.
Okay.
So
Hmm.
it's really cool to be able to live through his memory through, my
Yeah.
patients sharing what they remember about him.
Yeah. Did he ever play in the ABA? I don't know if you know.
I don't know. Look, we got technology. We're gonna Google
But we
this.
do have
Orlando
because
Woolridge, ABA. Let's see.
it probably doesn't come up, but it was before the merger, or that it
Right.
was the merger, and my grandfather was a orthopedic surgeon for the Memphis Tams. So
Oh,
I
very
don't know.
cool.
Maybe they saw each other out there. I don't know,
That is
but
so funny. The basketball worlds are small. They are pretty small.
it's
So
good.
yeah,
It's awesome.
uh,
All right, so getting a little deeper,
yeah.
before we wrap up. So, was there ever a moment in your medical journey, whether during school training or clinical work, where things felt especially difficult and you
Mm.
questioned the path? And
Oof.
then what helped you push through?
This is a quick ender. Oh my God, I could go on for three
No, no,
hours
it's
about
fine.
that.
Yeah.
I'm like, how much time you got? Man, yes. Okay, where do I start? I'm kidding. It wasn't that bad. No, it was,
It was pretty
it's
bad.
life,
Oh yeah,
right? It's
yeah,
life. Like, because
yeah.
that's the hard part. Like, life doesn't stop happening just because you're pre-med or because you're in medical school. Like,
Right.
you'll go through breakups, you'll go through,
Hmm.
unfortunately, family members passing away. Like, all
Hmm.
types of things will happen. And yet you'll have to sort of bury that and like show a good face for the next patient that you see. So that is really a part of life. And as unfortunate as it can be in those moments,
Hmm.
it's very much, skills that you will need for the future. Like when you are a
Hmm.
doctor and, something unfortunate happens in your life and your patients still need you and your patients still expect you to show up for them. So
Hmm.
really important to learn how to kind of make it through those experiences.
Hmm.
Let's see, what can I mean, I guess I'll chat about kind of standardized testing, and I'll talk specifically about kind of the STEP exam. So,
Yeah.
for those who may not know, standardized testing does not end at the MCAT. So, there's
Forever and ever.
gloriously,
Then you
yes.
get
Oh my
boards.
God. Man, yeah. So, Lord Jesus, and then like re-upping for, anyway. So,
Hmm.
in medical school in the US,
Hmm.
you have to take these STEP exams. And so
Yep.
there's step one, step two, there's kind of two parts of it, though I think they phased out one of the parts. That's how old I am. Step three, which you take in residency. And so these are big standardized tests that basically tell you, tell residency programs when you go to apply, like
Hmm.
how competent is this person with regard to their medical knowledge. And so it tests you on kind of everything that you've learned in medical school. So they're
Hmm.
pretty daunting. Um, Again, this is a back in my day.
Yeah.
Step one was a numerical score that you would get.
Yeah.
It is
Yep.
now a pass-fail exam,
Yep.
which, God, I'm gonna have a midlife crisis after this, but not right now. So
Yeah. Yeah.
it was numerical back in my day, and it was very much one of those tests that was like, oh, if you want to be in orthopedics, which at that time I knew I wanted to.
Yes.
If you want to be an orthopedic surgeon, which was the goal at that time, you got to get, a 250 or above, which is like an
Hmm.
insanely high score back then. And so I went super hard studying. I was like, I must do this. I was team
Hmm.
ortho from day one of med school, having been
Hmm.
an athlete, dealing with my orthopedic injuries. I had scoliosis as a kid, had to wear a back brace for years.
Hmm.
Yeah, so I had lots of experience with ortho. So that was it for me. I like wrapped my whole identity around like I'm gonna be an ortho girl. For anyone who watches Grey's Anatomy, like Callie from
Yep.
Grey's
Yep.
Anatomy, that was me. I even used to like roll up the sleeves of my white coat like she did on Grey's
Yeah.
Anatomy because I was like,
Yeah.
ortho god, like I got this. So
Yeah.
anyway, it was ridiculous. But like I said, that was such a huge part of my identity.
Yeah.
And I take the test and I get my score back. And I remember I was headed to, I think I was on my internal medicine rotation in third year when I get the score back.
Hmm.
And one of my friends like, oh my God, I got my score back. And this, of course, says what it is. And I'm just like, okay, whatever. And then I go to check mine and I'm like, this is going to say 250. It's going to say 250. And it did not. It said something that was
Oh,
lower,
lower. Yeah. Lower.
lower than 250. And
Yeah.
I was just panicked. I was like, oh my gosh, my life is over.
Yeah.
I'm never going to be able to do the things that I want to do. Like this is it. This is my dreams are crushed. My mentors are going to be disappointed. Like for
Yeah.
real, went through a general identity crisis because I'm like, I just can't do this anymore.
Yeah.
And I talked to a lot of people about it, and they would all give me the like, you'll still be fine. Like you're getting honors in this, and you're doing this, and like you've got a great application, and this isn't going to hold you back. And I was just so in my head of like, I'm never going
Yeah.
to be able to do what I want to do because of this one score. And it shook me a lot. And
Hmm.
the important kind of speed bump that put in my life is it forced
Hmm.
me to really sit down and think about like, what do I actually really want to do? And how am I preparing myself for that?
Hmm.
And so I was able to kind of sit with myself and say, okay, yes, I like musculoskeletal medicine. Yes, I like sports.
Hmm.
I've kind of wrapped my mind around like I have to be an orthopedic surgeon to do those things.
Hmm.
But like, what else is there? Like, what do I actually like doing? Like, what
Yeah.
do I actually enjoy?
Yeah.
And I had that same kind of come to Jesus moment when I was in college, right? When I was
Yeah.
like, I have to do molecular bio because everyone else is doing it who's pre-med. And then I found
Yeah.
SPIA, and that was a much better fit for me.
Yeah.
And so same thing happened. I was like, Tana, when you think about it, when you did your surgery rotation, you didn't actually like it. Like
Yeah.
when you were in the operating room, like you were getting antsy, you were getting fidgety, like you wanted to be out, talking to patients, you wanted to be out in the community,
Yeah.
working on different health interventions, doing health education work, like you wanted to be outside of the hospital doing stuff and like
Hmm.
spending 14 hours a day in the hospital in the operating room every day. Some of your classmates love that. And like you
Yeah.
could see the passion in their eyes, and that just wasn't there for me. And so this kind of speed bump or this guardrail that this low score had kind of forced me to kind of step back and be like, okay, what am I doing?
Yeah.
What do I want to do? What do I feel passionate about?
Hmm.
And I realized and made that pivot at that time. You know what? I love my general pediatric rotation that I did in third
Right.
year of school.
Yeah.
And I went off and did my MPH, and I was like, I loved working in a school setting and doing kind of community health education and things along that nature. So I was like,
Hmm.
I think it's pediatrics. Like I think it's working with young people and giving
There it
them
is.
the chance to kind of prevent
Yeah.
injury, prevent illness, learn about their bodies, feel confident in their bodies and in their skills.
Mhm.
So made that pivot and then discovered the world of primary care sports medicine, which perfectly marries all of those worlds where
Yeah.
I can work with kids, I can focus on injury prevention, I get outside of the hospital with all this sports coverage and team coverage I do.
Yeah.
I'm able to do procedures, but like short-term procedures where I'm not in the
Mhm.
operating room for 10 hours, but I'm
Yeah.
doing the procedure within 15 to 30 minutes. And I'm able to just live my life. And it was an incredible fit that I don't think I would have
Yeah.
found if I had gotten that 250 and like just locked myself into ortho in the way that I thought I had to. So yeah,
You're in the
sometimes
right
redirection
place.
is important.
Yeah.
Exactly. Redirection is necessary sometimes.
Well, that's lovely. All right. So, Dr. Woolridge, thank you so much for sharing your story and insights today.
Of
Your journey from
course.
Division One athlete to physician and advocate for athlete mental health is incredibly inspiring. We're grateful to have had you on Athletes in Practice. Thank you so
Good to be
much.
here. Thanks for having me.